Good evening, everybody. Thank you for joining This Woman's Words for our presentation and roundtable discussion on the Black Maternal Health Crisis. This evening, I have with me some wonderful people that you see showing up on the screen in front of your very eyes like magic. So I first want to start off by introducing Dr. Stephanie Baker, who will be doing our presentation this evening. She will also be presenting she'll also be part of our roundtable discussion, which will also feature Adrienne Barr, Kiah Glenn, and Mtende Roll. And so without further ado, I'm going to turn it over to Dr. Baker to get us started. And I am going to make her a co-host because something in my spirit says she might have something on that screen that she wants to share. Dr. Baker,
your spirit has lied to you tonight because I do not have slides. When you said informal, I said, okay, informal it's going to be. And so
let's have a conversation then. Come on, Dr. Baker, come straight off the top of the head. I love it.
There will not be slides, but I want to kind of create a little context and share a little bit of information about this topic, about the Black maternal health crisis. And I think it's so critical for us to think about it from a historical perspective. And so the comments that I'm going to be sharing today are really highlighting some really important things to consider as we try to understand where this Black maternal health crisis has come from and what it's really going to take to get us into a different space. And I like to also just set the stage that I am not a historian, and so there will be pieces of the story that are absolutely left out. Today, this is not an exhaustive background about health inequities in Black maternal health, but hopefully it's sufficient to inform people about things that they may or may not have known, to help people create connections and links between the history of the past and what we see today, and to start us thinking more creatively about how we work together, how we connect with one another to create some solutions to the issues that we have. And so I'll start out with just sharing some statistics because you can't not do that when you're talking about health issues. And these statistics are really difficult, to talk about. When we're talking about maternal mortality, and that is when birthing people die as a consequence of pregnancy or childbirth, the rates are hugely different when we're looking at Black and white birthing people's outcomes. The most recent data that I've seen, and I think it was from 2020, I think it was published in 2022, has shown that the rates of maternal death for Black birthing parents are 55.3 per 100,000. compared to their white counterparts, which are 19.1 per 100,000. So 55 versus 19 per 100,000 birthing parents are dying. And that is a really significant inequity, particularly when you think about the fact that we are in a developed nation, right, that has a lot of medical technology development, a lot of resources and access to care, right? So the fact that we have any maternal mortality is problematic, but the racial inequities are even more problematic. When it comes to infant mortality, that's another indicator that we look at a lot when we're talking about this health crisis. Nationally, 10.8 Black babies are dying before their first birthday. 10.8 per 1,000 Black babies are dying before their first birthday, compared to 4.6 white babies. And if you look a little bit more narrowly at Alamance County, the difference is 12.8 to 4.8. Right. And so if you look overall at infant mortality in Alamance County, it may not look horrible. It's around 6 or so. Right. But then when you start to take apart the data and look at the differences based on racial and ethnic identity, that's where you start seeing these inequities arise. And so the reality is that even as we're putting more attention to these inequities in our present day, they have been around as long as we have been measuring them. And I imagine they've been around even when we weren't measuring them, that it's impossible to bring a population to force a population of enslaved Africans into, perpetual servitude, and to take ownership and rule over their bodies and not have inequities result, because of that incident. And so, I mean, that's the start of it, right? And so we have to look at the history, because what we know is that history impacts what we see today. And there are connections that oftentimes we don't get an opportunity to make because we tend to be an ahistorical society. We see the problems in the present day and we try to solve them without understanding where they came from. So if we take it back, to the period of enslavement in the United States context in particular, Black women, Black birthing people's purpose for procreation was completely changed as a consequence of enslavement. Procreation was about increasing the workforce on a plantation. It was about increasing ownership of human bodies. And so you can imagine that having that history tied to being pregnant and having a baby and raising children is certainly going to transfer across generations to impact what the experience of pregnancy and childbirth is. During enslavement, there's also a very well documented, evidence of the medical research trauma that was perpetuated on enslaved Black women birthing people's bodies. And the case that, many people are familiar with, or the story that many people are familiar with, is that of J. Marion Sims, who, was named the father of gynecology because of the advances in procedures and surgeries that he provided to that discipline. And again, more recently, as there's been more transparency around that history, there's been an acknowledgement that his experiments and his progress and everything that he was able to give to the field of gynecology and obstetrics came on the backs of enslaved Black women who were not asked, do you want to participate in this research? They were not given pain medicine. So he's really just, perfecting procedures that many of us experience, these days, without any kind of pain control and without any kind of consent. And so, there are documented notes, all the evidence is there that this took place. He experimented on around 11 enslaved women, including 3 that were named in his notes. And I think it's important to start lifting up their names, Anarcha, Lucy, and Betsy, as, they are our heroes, right? They survived an unimaginable experience. And he was deemed the father of gynecology, right? And so again, there's been a lot of pushback to that, but we can't disconnect that history of treating Black women, Black birthing people's bodies as items that are to be, experimented upon, items that are to be dehumanized, and not connect that with how the medical profession continues to develop and produce information and knowledge about medicine, or about how people perceive their patients or their clients that are being served. The other thing that I wanted to talk about with respect to history is just the nature of what it means to be pregnant and birthing, and who cares for a person who's experiencing that. And so when we look back again in the United States context, which is the context I tend to talk about because it's the one that I'm most familiar with, but in the United States context, when we think about enslavement, there were Black women midwives, right, who were in the community, who were not only responsible for supporting the pregnancy journey of birthing people who were Black, but also of white folks, right? They were delivering babies. They were the experts in lactation. And it wasn't a professionalization. It wasn't, a degree or a credential. It was what they knew. It was what they learned, and they provided that type of care. So then when we think about historically over time, the irony is that there are very few Black midwives in our current present day. So a field that was predominantly, occupied by enslaved Black women now has moved into a space where Black women and other people of color have been systematically excluded from that opportunity because of the class of the professionalization and credentialing that provides advantages and opportunities to some people and provides disadvantages to other people. So when you think again about who is part of your pregnancy journey, who's a part of the actual delivery, and what knowledge do they have, what resources are they sharing with you, that has essentially been taken away from many Black birthing people. There was also a period of time, where getting access to systems and institutions was really important. It was important because it was a sign that maybe we were making progress in our society. And so there was this stigma associated with having births at home, right? If you were able to go into the hospital and deliver, it said something about your socioeconomic status or your potential opportunity or the ability for you to go into a typically white dominant space and deliver a baby. And that shifted and changed a lot of dynamics of what it meant to deliver and who was there to support you in that delivery. And so we can't divorce that. We can't separate that history from what we see now, right? We hear a lot about, the state of hospitals and how birthing is such a medicalized experience. It's such a it's such a procedural experience instead of kind of the natural and experience that people were ushered into historically. So what comes sometimes with access to our institutions and systems is access and exposure to discrimination and being cared for improperly, right? So you have that shift, and then now you have the present day where there is more acknowledgement about the fact that not only are hospitals and healthcare systems, not only were they created and structured in ways that create racial inequities, but they also really lack accountability for what's actually happening within them. The attention that we're hearing more, broadly, I would say, about the Black maternal health crisis and other types of inequities, a lot of that is because famous people, celebrities have been brave enough to talk about what their experiences are. Their experiences aren't new. And, you talk to any Black women or Black birthing people from the past, and you will hear very similar shared stories and experiences about how they have been treated when they are interacting with our healthcare system. So there's this acknowledgement that yes, our systems aren't doing what they need to be doing for Black birthing people, yet there's no accountability for what's actually happening in our systems. And that's for birth outcomes, and it's for almost any other health outcome as well. A provider makes a mistake, or they don't listen to their patient, or they make a suggestion for a procedure that's not necessary, and it turns out bad. Well, how is the system then holding themselves accountable to do something different the next time? That accountability just really doesn't exist in our medical system. And, so that's like a brief history about the healthcare aspect of it. But I think it's also important to acknowledge and recognize that all of this is wrapped in systems of oppression. And for Black birthing people, it is wrapped in racism and it is wrapped in sexism, and the way that those two systems of oppression intersect with one another. So we have the structural components of the type of care that you are provided, the lack of power that you might have in determining your own experience in our systems. And then you also have the racism and sexism that are impacting you in pretty much every aspect of your life. And you can't experience racism and sexism without having physiological consequences. Racism and sexism and exposure to that create huge amounts of stress. And stress is one of the most common risk factors for any type of health condition. Any type of health condition, stress is one of the most common risk factors. And this gendered racial stress is especially impactful. It gets under the skin to have physiological impacts on the ability of Black birthing people to get pregnant, to stay pregnant, and to deliver a baby and themselves healthily, right, through that experience. And so there are lots of different ways to think about what the solutions are, right? But we have to understand where the fundamental cause is. And that fundamental cause is the structural racism that our society has been built upon, right? Because without that, you don't see the stress, right? Without that, you don't see the ways in which our hospital systems are just structured to create racial inequities. Without the structural racism, you don't see implicit biases that people have against other people. And unfortunately, we have a lot of work to do to work together collectively to figure out how we are going to address structural racism. It is a ginormous issue, right? And it is the common cause of all the racial inequities that we see. And so we have to do a both and approach when we're talking about this Black maternal health crisis, right? Intervene where we can in the moment, and also keep our eye on the prize of what the true problem is, so that we don't stop our work in a shortened way. And so I'm going to stop there, and hopefully that gave enough of a little bit of a background for folks to kind of engage and kind of have this discussion, and would love to hear the other panelists weigh in with the questions that come.
So there's nothing like starting an event with Dr. Baker, who just blows your mind repeatedly and then says, and I'd love to hear what everybody else has to say, right? No pressure, y'all. So I'm going to start with Kiah Glenn. So Kiah is going to discuss a little bit about her own personal experience with the Black maternal health crisis. And after Kiah, Adrienne Barr will discuss her own experience, which is drastically different, and what she thinks may have been a factor as to why it was so different. And then we'll have Mtende weigh in on her thoughts about Black maternal health crisis generally and any experience she may have in that realm. Kiah?
Thank you. So I think the best place to start is to say that I had all of the things, right? Stephanie mentioned, I had a midwife. I did not have an OBGYN. I said, no, I'm going to go the midwife route. I had a doula. I had a birth plan. Everyone had a copy of my birth plan for both children. I had stipulations in my birth plan. So with my oldest, I was drug-free. I wanted to be able to be in a space where I had like the birthing ball and the chair and the tub. And I bought, like the lights were off to not use fluorescents, which interfere with like your labor. And I ate during my labor because I have like pre-existing health conditions that was like, I actually cannot go hours and hours and hours without eating. And so I had all of these things and everybody was on the same page and everything was great until the folks from the hospital got involved in my oldest. So in my first plan, We were about maybe, I want to say around hour 40 or hour 30 of me being in labor. And they were like, you haven't slept. And we really want you to go to sleep. And people are starting to get, you're not progressing. So we're a little anxious. We need you to rest. And, we would really like for you to get an epidural. And I was adamant, like, I did not want an epidural. I really didn't want to do this. And my midwife was like, well, we'll just, give you the epidural, let you sleep, and then we can wait till it wears off, and we'll continue as it goes. And I was like, I don't know, because everything I had read up until that point was like, once the medical interventions come into play, things just don't always go. And I already was apprehensive. I had grown up with a chronically ill parent. I have been in hospital situations and seen how, like, folks who are not on your team treat you very different, and I didn't want them involved. And so I was like, I really don't want this. But they were very concerned at how long the birth was taking, and that I hadn't progressed, and how tired me and my partner were. So they convinced me to get the epidural. Well, the first one failed. I could feel it burning. I started screaming. So they were like, okay, cool. We're gonna, try again. Maybe 15 minutes later, they tried the second one. The second one took. Well, the issue became, they put me in the bed. They told me and my partner to go to sleep, and they were like, we'll come and check on you. Except that my doula went to go. She was also gonna sit, but she was sitting, so she was facing me, and my partner was kind of behind this curtain, like it kind of wrapped over. Well, I lost all ability to speak and started having seizures, but nobody knew because I couldn't say anything. So my doula just happened to look up, and she's like, what is this? What's going on? Hits the emergency button. My midwife comes in, because now I'm throwing up and they can't get the stuff to come all the way out. And they start to like, all of a sudden pieces start moving. So they call in the anesthesiologist, and the anesthesiologist has no clue. They're calling in the surgeons because they're like, we don't know what's going on and why. The issue started immediately because my midwife, my doula, love her. And later on, we found out she was pregnant and she didn't know, started to cry hysterically. But she was white, and they were like hugging and comforting her as she's crying. So her and my midwife are like hugging, and she's crying. I'm seizing. They're having all these people flood in because they're like, you need to go into surgery right now. But I have no ability to speak. I have nothing. My husband is asleep. No one has woken him up. Nobody has informed him that they're getting ready to take me into surgery right now. And the noise level increases, and that's what wakes him up. And so he like gets up and he says, what's going on? And they go to call security because they were like, who are you? How did you get here? And he's like, this is my wife. What are y'all doing? And I'll never forget, the surgeon basically like took the paperwork and the scrubs and like hits him in the chest with it. And he was like, we don't have time to explain it to you. She has to go right now. Put on the scrubs and come, or don't. Do you have any questions? And my husband's like, I'll set it off, but I'm not going to ask any questions right now. Save her, save the baby. They talk to me, but I'm seizing and I have no language. They strap me to the bed, which now I'm panicking because I have no control. They rush me into the room, and I'm now vomiting and no one is watching me. So I start to asphyxiate, and it's not until the thing goes off that I'm no longer breathing that somebody's like, oh, well, maybe we should sit next to the birthing person's face to make sure she, is comfortable. Maybe we, clean out her airways, and somebody can sit with her while her husband like has to now get dressed to come in. And so it was not the birth I planned. It was traumatic, right? And then afterwards, when you go to recovery, they check you like every hour. And nobody thought that maybe I would be exhausted until I fainted. And they were like, oh, I guess we should give you some space. And I was like, yeah, that would be great, because I've been up now for 72, almost 80 hours. And in recovery, my body doesn't know what happened. We've just been cut open and baby taken out and all of these things. A nurse comes in and she's like, the baby is crying. Have you tried to like feed him? And I'm like, he's not latching. And she's like, oh, yeah, women with bodies like yours can't breastfeed, so you're probably not gonna be able to do that. I'll send somebody in here with formula. So I start to cry. My husband's like, you can go ahead and go. And so it just continued to go down from there. So when I had my second, I was like, I do not want this. I do not want these people involved again. And with my daughter is a VBAC, so a vaginal birth after cesarean. So I was able to have a vaginal birth that I, in my next plan, wanted, except that the nurse who came in was like, you wouldn't know how to have a baby. You've never done it before. And I was like, well, yeah, I've had a baby. And she's like, no, but not like this. So you wouldn't know what to do. And she's like, well, I'm going to leave. And when I come back, like, I'll teach you how to have a baby because you wouldn't know what to do. So she comes back and my midwife is like, my doula was like, she's having this baby. Like, the baby is crowning. She's like, there's no way she wouldn't know how to do that. Moves my leg and goes, please hit the emergency button. This baby is crowning. It was a time. They refused oxygen at one point until my husband demanded it because I was not breathing. They had to give me some medication with that one because my son was present and I couldn't focus, but I couldn't breathe. And the nurse refused oxygen until it was, my husband was like, then put it in the chart that you're denying her oxygen. That team just, even though my team was present, whenever my team wasn't present, these outside folks just acted like I was incompetent and like I wouldn't know what to do. And then post my daughter's birth, I ended up being diagnosed with a seizure condition that is usually diagnosed with people with extreme trauma. So like when Stephanie mentioned, the racialized trauma that like Black women and Black birthing folks undergo, I was like, and it has real outcomes because now I have a condition where it's psychogenic non-epileptic seizures. And my thought, and there's other thoughts that they're directly correlated, right, with all of the traumas that were put on my body in these situations, and probably outside of that as a Black Muslim woman, and they have real outcomes, like they have real tangible things. And so I love my little humans, but with my oldest, I almost didn't make it. It was almost a pick your, and I had already written to save the baby. And with my daughter, I was just going to have to do it myself because the nurse was just convinced, like, I don't have to get your midwife. You don't know how to have a baby. So yeah, those were my experiences. And they were just, I'm just glad to be alive, really, when I think about them, because really, for many of us, it's just, we just don't make it. Like, even with the best plans, we just don't make it. And I know what that's like because I knew, at least with my oldest, I was like, oh, I'm not making it. Good to know. So there's that. I will pass it to Adrienne.
I just want to start off with saying, Kiah, I'm glad that you had support. I'm glad that you had people who were forceful enough to make sure that you got exactly what it was that you needed. And I'm glad that you were able to overcome all of that, because that is a lot. And I am livid. So let me try to calm that down, but yeah. So I will talk about my birthing experience, which is drastically different than what Kiah mentioned. I didn't have a plan. I conceived my senior year of college. So the plan was have this baby, walk across this stage, because we ain't wasting no tuition, because tuition is high. That was the plan. We're going to figure it out. That was the only plan that I had. I did do my research by reading, things of that nature. My medical care was stellar, for the area that I was in Charlotte when I gave birth to my daughter. My medical team was good. The birthing process, me and Leah, we kind of fought a little bit. I begged for drugs because I knew I wanted drugs. I saw what they were doing on the baby story. And I was like, that looks like that hurts. So I definitely begged for drugs, trying to lighten the mood. I definitely begged for drugs. And that's really when the problem started. I stopped dilating. So maybe they may have given me my drugs just a little bit too early. So I stopped dilating at 5 centimeters. They gave me Phenergan, not exactly sure what they gave it to me for. They never exactly told me. But I learned a fun fact about myself. I'm allergic to Phenergan. It makes my lips swell. It's fine. They're big anyway. So there's that. Again, still trying to lighten the mood. But, eventually we did have to, have a cesarean. My anesthesiologist was great. And, we went home with happy and healthy baby 3 days later. And if anything, if I could change anything about postpartum, right? I didn't have any issues, during, prenatal stages, postpartum, during the birthing experience. But postpartum, I wish someone would have had a conversation with me about postpartum depression. If anything, that's where enough questions weren't asked. Took Leah to her wellness visits. Again, I was a senior in college and very poor, so we definitely had WIC. And they ask you certain questions during those WIC interviews, and I feel like maybe they could have dug in deeper. I feel like maybe my doctor could have, asked more follow-up questions, because I definitely suffered from postpartum for the first 2 years of Leah's life. And I did not realize that that was what I was experiencing until I was better. I couldn't explain it. And I was comparing the person that I was at that moment to 2 years prior, and just really like looking at things. It's like, oh, so you really had these type of thoughts where they could have been problematic, and had somebody asked me or let me know that, because of the drop in, hormones in your body just reacclimating, be on the lookout for things and let us know. So if anything, that's where the system, failed me, but everything else was fine.
All right, and I can also jump in a little bit. First of all, thank you for both of you for sharing your stories, and also Stephanie for sharing a little bit about that history. So I'm a doula, part-time doula, and for those of you who don't know what a doula is that we advocate to support birthing people pre, during, and even post labor. And there's many different forms of doula support, whether it could be physical support, emotional support, mental support. We can be doulas for people, your support group that's in the room. So being a doula for the kids, if you want the kids to be a part of this journey, or your partner to help them be adequate support for you, as well as you have postpartum doulas. So post your labor, you can have doulas who can come in and help you take over night shifts. And I'm not a postpartum doula, but they are out there, definitely out there. And we'll share some resources at the end. But just hearing the stories, like we shouldn't be living in a society where you can have either outcome, where you can tick all the boxes, have a birthing plan, have a midwife, be in a birthing center, have a doula, and then maybe you'll have a positive outcome, or not have a plan and then maybe have a positive outcome. That shouldn't be the case, and that's what we're seeing across this nation, across this world. And I've had experiences I've had one Black birthing person who had a pre-existing condition. We go into labor, and me and the birthing person's parents are both advocating because there was something not right physically with their body. But the nurses and the doctors were like, well, we don't see anything with the uterus, so everything's fine. But there's a whole person attached to that uterus. And we had to advocate for hours and hours and hours, and then eventually got her moved over to a different unit or a different hospital to get the adequate care. And that shouldn't be the case. We shouldn't be advocating and fighting with nurses and doctors. And the thing that I want to highlight when we have these conversations, that a lot of the times people will assume that it's just people who are evil and bigoted and ignorant doctors who are purposely waking up in the morning saying that I'm going to do these things to Black birthing people. But the reality, the sad reality of it is that it's not just evil-minded people, but but it's good intentioned people. Majority of this is coming from good intentioned people. And going back to what Stephanie had mentioned earlier on, that if we don't have this racial analysis, when you don't understand what is happening in the intersectionality of both race and gender and sexism, that we're still going to see these outcomes. So I just wanted to add that to this conversation, because I think it's very important for us to have it, because at the end of the day, this is people's lives. We're talking about human lives that are at risk when we don't hold people accountable, when we don't hold our systems accountable and understand what we're talking about. So yeah, I just wanted to add that to the conversation.
I just have to pause here and thank you all for your words and your stories and your insight. Kiah knows that we're going to have a conversation offline about Kiah's birthing experience, because I feel it. And I feel a way because I think that, as Mtende was just saying, when you have all these people in the room, there shouldn't have to be a fight and an argument. Like, you're going through this physical and emotional moment, and it should not also have to be one of, if you're not able to advocate for yourself, all these other people have to jump in and essentially have an argument. Like, I don't feel like that should be the case. And yes, so we're gonna have a conversation offline about that. Initially, I had asked the panelists to kind of jump into another question after everyone gave their own kind of thoughts around the Black maternal health crisis, but I think Dr. Baker covered a lot of that in her analysis. So I'm actually going to I want to merge some current events and current topics with the conversation around the Black maternal health crisis, because I think that some people automatically assume that if they do not meet the criteria of Black and maternal, right, there is no conversation to be had that affects them. So when we're thinking about the recent Supreme Court decision to overturn Roe versus Wade, and what that looks like as far as medical abortions in some states, states' rights, states' determinations, how we already see a lot of legal fallout around that decision within each state. I'd love to hear y'all's thoughts on how the Black maternal health crisis is kind of impacted by that decision, and what that means in a way that people may only be thinking of it on the front end about getting an abortion to prevent having to go through labor, but what that may look like in a medical situation where perhaps an abortion might be necessary.
So I will say I'm not an expert, right? Like, I'm not a lawyer. That's you. But what I can say from somebody who worked, with closely with folks for a while is just it's the Black maternal death rate, or the death rate for Black folks who can get pregnant, is going to be exponentially higher in spaces where you cannot get access to your reproductive rights and the things you need for your health, right? Like, it is a health issue, whether or not you want to get, and have that as your experience, it's still a health issue. And because we are less likely to be believed and less likely to be deemed a good patient or a good fit, or to be telling the truth, or to be, fitting the criteria, I think we're going to see dramatic fallout, not just in like, oh, this person like can't get the care, so they're going to have a baby. No, like, I'm so concerned about folks opting, to, exit life because this is not what they, they don't have options, right? And so seeing people die from, suicide, or from attempted at home, things, or, intimate partner violence increase because of you can't now access these things. I think people are so short-sighted. They're like, oh, well, just because you can't get X. I'm like, okay, but that has so many ramifications and so many other things and so many outcomes. I mean, we're already seeing the fallout from that in so many different ways. And it's just wild that people think that was a win. I'm like, people are going to die. People are going to lose their lives. People are going to lose jobs, scholarships, access to education, homes, all types of things. Like, it is all tied together because it's all intersectional. So, like, to think that this one thing, is it going to have these ripple effects? And even the thought of, like, yeah, if you do have this child, but don't want this child, and this child enters the system, that system is trash. Like, that system is trash. The child is not entering magical unicorn rainbow land. It is a trash system. So, like, people joke, they're like, oh, I didn't ask to be here. Like, but I didn't ask to be here. And now look at what you're putting me in. And so it's the fallout is astronomical. I don't think that we can even calculate, because we are also, Black women and Black birthing people are less likely to be counted in statistic numbers and less likely to be even measured. Like, our loss of life and our pain and all that are less likely to be measured. So the numbers that we will see won't even probably include all of us. And so we won't ever know what the true damage that is done will be. Even though I know there are things being put on the federal side, but yeah, I just think we don't know how far the ripple will fall.
Anybody else want to jump in on that one? Or are you saving all of your energy for my future questions? Okay, my future questions, got it. Okay. So my next question is, so we're now in July. And as we were working on this event, we were in June and it was Pride Month. And I know that some people who are watching this are probably asking questions around the Black maternal health crisis and language like Black birthing people. And so I'm going to start by saying, let us keep in mind that everyone with a uterus does not identify as male or female. And that there are people that do have a uterus and cannot have children, right? So birthing is a very different situation for a variety of different people. So that is where the language around birthing people comes from. But I'm interested for our panelists where you all feel like we are missing the mark in not just using the language and updating the language, but in updating what that care looks like or what that advocacy and that data looks like around birthing people as opposed to just Black women.
I think that's another intersection that, again, like you just mentioned, there hasn't been a significant amount of attention brought to. And so when you look at, for example, access to healthcare insurance, LGBTQ populations are less likely than straight populations to have healthcare insurance. When you look at how LGBTQ populations are treated in healthcare, just in terms of routine examinations or being offered STI testing or pap smears or whatever, it doesn't happen at the same rates that it happens with straight folks. So when you're talking about even preparing yourself to conceive, right, like to be as healthy as you possibly can, you're already starting, behind the line, right, behind the starting line, and you layer LGBTQ status with race, ethnicity, and then it magnifies, right? So I do think that there is a significant amount of education that providers need to experience around the use of terminology, around ways in which the medical system is set up to discriminate against our LGBTQ brothers, sisters, and siblings. And again, to be for people who identify in those communities to have some type of support, leverage, or way to require the systems to work for them in the ways that they should be working for everybody. I hear a lot of assumptions are made, stereotypical treatment is happening in hospitals and with providers, and And I've listened to some providers being interviewed, and they talk about how they don't learn any of this in medical school or in nursing school. And so it is time for an overhaul of those curricula, because we are in a different day and age, and people need to be able to care for anybody who comes into their presence, no matter what their identity is, no matter, in light of what their identity is, right? Like, they need to be aware of it. And unfortunately, it takes a long time for our healthcare provider education to catch up. I mean, they're just now, like, they've been doing stuff with social determinants of health, and just now hearing folks talk about racism. And so there needs to be an accelerated urgency to better prepare people who are in school, but then also to educate folks who've been in practice for a really long time and hold them accountable.
And I think it's always, where there's gaps, like, communities will fill. So, like, one of the things that I've seen being in community is, like, the rise of, like, queer folks, like, becoming doulas, like, specifically to address these issues, right? So that they can be in the room with families and, like, create that space so that folks feel seen and feel safe, and so that they too can have, like, a birthing experience that is positive and beautiful, and everybody is on the same page. And it's sad and beautiful that, like, we have to, in our own spaces, create the care that we want to see and want to demand, right? Like, that's both, like, ingenious and intuitive of us to be like, okay, well, it's not here, so we're going to do it. But it's also, like, to Stephanie's point, y'all should be doing it. Like, it doesn't make sense why people have to explain to you who they are, their family structure, or what they want, and you be like, well, I've never experienced that. You can Google, it's free. Books are there. You've got multiple degrees and still look dumb, and that doesn't make any sense, right? Or even, like, if we're talking about, when you had Mrs. Shria, like, some folks with the uterus don't want to have a child, and the way the work that it is to get them to get your tubes tied, the steps, because they're like, oh, well, you might, like, one day change your mind. Have you talked to your husband? Weird that you assume that I have one, number one, and weird that, like, you care about this mysterious non-person that's not here, right? And, like, the way the healthcare system is just so outdated, and the experiences, like, folks who have been like, I just want to be able to live my life healthy and happy, and this system at every turn will be like, no, like, it's too expensive for y'all to be this far behind. Like, I'm paying too much money for y'all to also me have to do work and pay you. They're not matching.
I just want to also add in, and this is how systems intersect, right? So we see all this anti-CRT and anti-LGBTQ legislation that's happening in our education systems. The can't say gay, you can't talk about different types of family configurations with K through 2. So you are teaching very young children, instead of to understand and explore the diversity of people, to not acknowledge that certain people exist, to not embrace people for who they are. So when you grow up in our K through 12 system with that type of education, with the lack of history, with the lack of representation, then yeah, you're going to go into medical school or nursing school or whatever school that you're going into, and you're going to bring those biases right along with you. And every time we start making some progress, the opponents are very well organized to push back. So we have to make it our business to be about this work, whether or not we're talking about healthcare or education or housing or legal, whatever it is, because they're connected. They're all connected, and they're working to create more challenges for historically excluded populations in our society, right? And so we have to see those connections.
I just want you all to know that the Facebook comments are on fire. I see Sylvia Ellington with a whole lot of exclamation points, and I can't read what came before that because it was moving kind of fast, but there are exclamation points. And so now my next question, I want to lead off with Mtende on this question. So what action steps can be taken by birthing people who are expecting, or by those who are trying to support birthing people who are expecting as they enter into their birthing experience?
Yeah, thank you. I mean, having a supportive base. And I want to explain what I mean by a supportive base. A supportive base, like we understand, especially doulas now in age are very expensive. So affordability and access to doulas is not practical for many, many people. So having a supportive base could be families or partners. And specifically, I put an asterisk next to families because we have those family members that just want to be a part of everything. And that creates more stress than necessary. So be intentional about who you want in that space, because we have studies that show that the second somebody walks into a room during labor and you feel uncomfortable, your cervix starts to close. You become uncomfortable, it slows down your birthing process. So be very intentional about who you want in that room. And we are inundated with so much information. There's books, there's podcasts, there's Instagram posts. And I know people who have people in their lives who are going through the birthing process. You want to give them all that information, but maybe just hold on to it because they're already dealing with a lot. So please be careful as you offload all the stuff that you've learned. But having a good supportive base that could help you during and also post labor. I mean, we know that saying that it takes a tribe or a village to raise a child, and that is so true. Because postpartum depression is a real thing that many people experience, and that doesn't just happen for 6 months or 8 months after. It can go up to years. So we do need to have that supportive base. And another thing that I want to also add is knowing your body and advocating for yourself. I mean, we just heard stories of people knowing what is going on in their bodies and the medical staff not taking care of that. So when you pick your supportive base or your supportive people, have them also be advocates for you in those moments, because you know your body the best. You know what's going on in your body and you need to fight for yourself. Unfortunately, that's what we need to be doing. So those are the key things: supportive base, knowing your body, advocating for yourself, and being very specific and very intentional about who you're going to have in that room. And I think one of the nice things about being a doula is that I don't know family members, so I can be as rude as I want to them. I can kick them out of a room. So if you can have somebody who can just be in that process with you to say the things that maybe you're uncomfortable to say.
I've never seen somebody talk about being rude with such a huge smile on their face. I aspire, in fact. So now I don't see any questions in the comments on Facebook or in the chat on Zoom, but I do know that some of you all referenced having resources or different information that you wanted to share. So I wanted to open that up for you all to talk about that and or to drop information in the chat that maybe you have found useful or that you think other people have found useful, and I will transfer that information over to the Facebook comments as we go. So I'm not sure who might want to start that off.
I can quickly start. I just was going to drop in the chat some Instagram groups that you could be following. There's Birthing Advocacy, and they're actually doing a training in August to train people to be abortion doulas. So I've signed up for that. So if anybody is interested in getting information about how to be an abortion doula and what does that look like, especially with everything that's going on. There's also Birth Sisters Doula, Birth Equity, the National Black Doulas Association, Her Lab, which Stephanie can talk a little bit about that as well, and Soul to Soul Sisters. So those are just Instagram and Facebook pages that you could follow and get more information.
I also found Centering Pregnancy. It's a program that they have out of the DSS office. And, you know, one of my acquaintances, she used to work with that program, and they pull together about 8 to 12, you know, upcoming moms with the similar due dates. And it's kind of like a group setting. You know, they'll, you know, get you engaged in checking your, you know, your vitals, your weight, blood pressure. Everybody has an open conversation and dialogue about what's going on with their bodies, and things of that nature. So to just help, you know, reduce stress and self-esteem in a safe environment. So I'm going to drop that in the chat. You know, it's nice to hear something great that Alamance County is doing for its citizens.
I don't have anything for the chat, but what I will say is I did a group both of my pregnancies even though I didn't need it the second time, and they are really useful. And I would say one thing that I got the second time that nobody thought to suggest the first time is there are pregnancy chiropractors who help with pain and pain management. And so if you talk to like your provider, or if you don't have a provider and you're like thinking of ways of pain management, like you deserve all the pain management. It was the only way that I was going to make it to the finish line, because I actually ended up with a 4-inch hip displacement, and had to like have things realigned. So if you're feeling pain or you're feeling things and you're like, oh, it's just pregnancy, please tell your provider, because sometimes it's just not. And like for Black people, we're told like to just persevere, and they assume our pain threshold is higher, and it's not the case. And so oftentimes people will just be like, oh, that's just part of pregnancy, and it's not. Like my chiropractor was like, you shouldn't be able to walk. Your hips are so wild out of place. How are you walking? I was like, I don't know, I kind of just drag my leg. She was like, what do you mean? And nobody caught it because everybody was just like, oh, whatever. And so as you can, if it don't feel right, it's probably not. And so my thing is, if you don't feel like it's okay, please advocate, tell somebody, go to the hospital, get on your doctor's nerve, because you deserve the best care. And I don't care if they get annoyed with you. That's their job. That's what they have to deal with. And so there's that.
Yeah, and this is not a resource, but it is to just say that if you don't believe you're receiving the appropriate care, you can change providers. I think that tends to be something that we forget, that we do have a little bit of agency when it comes to our care. And an OBGYN reminded me of this once when I was on a panel, and she said, if they're not working for you, if there's anything in your gut that is telling you this is not it, don't question that. Go find somebody else where you will feel more comfortable, more supported, and because that will impact, the whole experience.
I think definitely that speaks to like that gender piece of being nice. Like, oh, I don't want to be mean. You're paying them. And even if you aren't, it's a service. So if you don't like them and it doesn't sit well with your spirit, you can find somebody else. They'll be all right. They will be okay. Please. I would rather you be safe.
So I have tried to document all the advice and the accounts that were referenced over on the Facebook page, but I did want to ask Dr. Baker to briefly talk about her lab.
So her lab is a health equity and racism lab. It is a lab that I co-founded and co-direct with my colleague, Dr. Yannicka Faustin. And her lab is really committed to centering an analysis of racism and understanding racial health inequities and using anti-racist approaches to address those inequities. And so while it is her lab and much of our work does involve maternal and child health outcomes and the health outcomes for birthing people, we will look at any inequity, because what we know is that the root causes are the same. The way structural racism impacts all of our health outcomes is quite similar in nature. And, there's just too few of us who have any kind of educational background about what these things are. I mean, I didn't get it in K through 12. I barely got it in college. And so we're committed to strengthening people's understanding so that we can create a larger number of people who have a deep analysis about where these issues are coming from and can bring that analysis with them into whatever area of their professional careers and their personal lives that they desire.
So I am going to open the floor up to all of our panelists to see if they have any final remarks before I close us out.
I just kind of want to piggyback off of something that Dr. Baker and Kiah mentioned, right? If things aren't working out with your doctor, make sure that you advocate and that you switch, because often we have that loyalty to a certain doctor. Do your research on your doctor, right? The moment that you find out that you are going to be birthing a tiny little human, go ahead and do your research. Sometimes, the OB that you have may not be the best fit. I mean, it's a great time for you to really start exploring things. And also, because you're paying them, be very, very transparent with them with what you're experiencing. I have found just through interaction with some people that they're not honest enough with their doctor. And very much, if you're paying for their service, or if they're, somebody's paying for their service, that's what they're there for. Go ahead and lay it all out there on them. There's nothing to be ashamed about.
So it appears that for the most part, all hearts and minds are clear, except for that side conversation I'll be having with Kiah shortly. So I just want to thank everybody on this screen with me, some of my favorite people, and talking about some of my favorite topics. So these are very difficult topics. I know that they are difficult to learn about and to hear about, but the one thing that I want to emphasize is how much information is available and how many people are doing the work. So we've given you several resources. We've talked about a lot of different studies, different stats. I quoted the White House because, of course, the Biden-Harris administration is doing some work around Black maternal health as well. So the information is out there. So if this is your first time learning about this crisis, or if you're somebody who is expecting or you want to learn more because you are planning a family, I encourage you to look into these stories. I encourage you to learn more about the experiences that people are having, the good and the bad. I encourage you to learn more about your options with doulas, with plans, with all types of things that you may not hear about in your traditional medical setting. And I would also say that if you are somebody who maybe already has children or does not plan to have children, but you're interested in getting involved, depending on where you are, you can reach out to your local hospitals and they can connect you with doula programs. If that is not an option for you, I encourage you to check out the different Instagram and Facebook accounts that Mtende's shared with us. Some of them will also connect you to different doula groups in your area to help you get trained so that you can serve in that capacity. I think that now is an important time to say that the underlying thread in all of this was advocacy, which could possibly explain my interest in this topic. So not only advocating for our babies and not only advocating for ourselves, but advocating for future people so that they do not experience what we have experienced or what we know of people experiencing, right? So I thank you all for joining us. Those of you that are on Zoom with us, thank you for being listening and being attendees. I see some old friends from law school here, so I'm so happy to have you all here. And shout out to the people on Facebook. I see some wonderful people from Alamance Achieves and some former coworkers from Alamance County DSS in the midst. And so I know that for all of you, children are very near and dear to your heart. And I'm happy to see what you all will do with this, or I'm excited to see what you all will do with this information and how you will share it with others. I encourage you to share the Facebook video. I will drop the YouTube link later on today. So if you would like that, please let me know. And thank you again, Dr. Baker, for always, just blowing my mind and being so casual about it. Thank you to Adrienne and Kiah for showing up and showing out as I knew that you would. And my sweet, angelic, but willing to put your family out of the hospital room friend, Mtende, thank you for being with us today. You all have a wonderful night. Stay safe. Bye.